the chat. And also, please include something that you'd like to get out of this learning collaborative. Oops. There we go. All right, so we'll start shortly. All right, well, let's go ahead and get started because we have 45 minutes and we have a great session for you all today. My name is Shante Davis Patterson. I'm the program director for California's Comprehensive Cancer Control Program that administers the California Dialogue on Cancer, which is a co-founder of the California HPV Vaccination Roundtable that's bringing you this learning collaborative today. As I mentioned, and as you see on the screen, please introduce yourself through the chat. Include your name, your organization, and what you'd like to get out of this learning collaborative. We have over 100 people who have registered for this collaborative, so we're very excited to learn about who is going to be joining us today. Just so you know, everyone has been muted, but later on we will have a discussion and you can just take yourself off of mute. Please do utilize the chat to ask questions. And as you saw, this session is being recorded, and there will also be an evaluation at the end, and please do fill that out for us so we can make sure that we're bringing you the best learning opportunities as we can. So we're going to start with a quick fun poll. These are the top 5 ice creams in the nation. So just as a quick icebreaker, let's find out what everyone is interested in here. So tell us your favorite ice cream. Is it chocolate, mint, Oreo, strawberry, or vanilla? And I see a lot of Oreos. Oreo is kind of winning out here. Still winning out. We'll give the poll a couple of more seconds here. All right, well, it looks like, okay, well, we're done here. All right, so it looks like Oreo did win. I didn't expect that. I, for some reason, thought it would be chocolate. We have 38% of you who like Oreo, followed by 26% chocolate, 23% mint, and vanilla comes up almost last, but strawberry is last. Sorry, strawberry. All right, let's see. Now I'd like to introduce the 2 individuals who will be moderating this session for us. And they are the 2 leads of our work group that you'll hear about a little bit later, but we have Dr. Julie Dang as well as Dr. Susan Park from our roundtable that will be facilitating for us. So without further ado, I'm going to turn it over to Dr. Susan Park.
Thank you, Shante. And hello, everybody. We are very excited to have all of you participate and take time from your busy schedules and hopefully launch this collaboration so that we can hear from you later in this day-to-day. So we're going to go ahead and jump into the overview of the collaborative and really the foundations of where this came about. Next slide. So this is a learning opportunity brought to you by our Engaging Health Systems and Provider Work Group. We're members of a larger work group by the California HPV Roundtable. So I want to briefly talk about what it is and what we do. This was established a few years ago, and this is the last picture of us when we met in person. But it's a coalition of diverse stakeholders with the mission to work together to prevent HPV-associated cancers and precancers by increasing the HPV vaccination rate in California to 80% by 2026. We have a website which you can refer to, but you'll notice that we run the gamut of academic researchers, providers, patient advocates, legal, pharmacy, dentistry. So by bringing all of these folks here to this collaborative, hopefully we can create partnerships for you at your health systems. Next slide. I want to specifically acknowledge the people that are in this work group for the health systems. These are people who are experts in their field that we hope will also be persons that you can reach out to for collaboration and advice as you go through your health system journey, spanning from insurance companies, academics, pharmacy, dentistry, a lot of folks who do their own work as well on HPV vaccination. And all of these slides will be available online. The HPV Roundtable has 3 main groups. The first one is directed at patients and parent knowledge, and they do a lot of social media work, holding HPV Vaccine Week. We have a very robust data group looking at data of HPV vaccination across all over California counties, and that is available on our website, and this is updated recently. And then we have our health systems group, which I alluded to. Next slide. So with that, I'm going to turn our attention to our speaker, Dr. Jenny Chen. She is a public health medical officer for our state of California immunization branch. By training, just pull up her bio real quick. She is a certified in both internal medicine and pediatrics, having completed more than 20 years of experience in the clinical practice of adult and pediatric medicine. And we're so lucky to have her here today to speak about the updates of HPV vaccination during this COVID period.
Great, thank you. Thank you for inviting me to review this very important topic about preventing HPV infection and HPV-related diseases. Next slide. Just a brief outline of what we're gonna talk about today. First is just the impact of HPV. So just kind of reviewing some of the basics about HPV that y'all probably know already, but we'll just go over it. We're also gonna then talk about vaccination against HPV. This is sort of more of a report about HPV vaccination data. This is pre-pandemic. And then we're gonna touch upon the impact of the pandemic on vaccination, specifically HPV vaccination. And that's gonna be reviewing some data. And then finally, we'll just talk about our goals about HPV vaccination, the coverage goals. Next slide. So HPV is a common virus. It's spread by person-to-person contact. There are many types of HPV, and of the more than 200 types, several are known to cause cancer, but types 16 and 18 together, they cause the majority of the 6 types of cancers that are listed here: cervical, vaginal, vulvar, anal, penile, and oropharyngeal. And since 2016, oropharyngeal cancer is the most common HPV attributable cancer in California and in the US. Next slide. So HPV affects and infects both men and women. It's estimated that about 80% of people will get an HPV infection in their lifetime. And the CDC reports that HPV infection causes more than 36,000 cases of cancer in men and women annually, and 10% of those occur among California residents. Next slide. Currently, the only cancer screening available for an HPV attributable cancer is cervical cancer and cervical cancer screening. So you can see there's a high potential to miss or even have a late diagnosis of these other HPV attributable cancers on this pyramid. Okay, next slide. We do have a tool to help prevent HPV infections and subsequent cancer development, and that is the HPV vaccine. So when the vaccine is given at an early age, it can prevent over 90% of HPV-associated cancers. It's been available for more than 15 years, since 2006. Yet, HPV vaccination rates lag behind those of other preteen vaccines, and over 1 million California teens are unprotected against HPV attributable cancers. The next couple of slides are going to review the HPV vaccination rates pre-pandemic. Okay, next slide. So the National Immunization Survey graph, this is showing, I'm going to try to go through it. I don't have a pointer, but this is basically the rates from 2005 up to just before the pandemic to like the end of 2019, early 2020. So if on the y-axis, you'll see estimated vaccine coverage, that's in percent. And then on the x-axis is the years 2005 through 2020. And on the left bottom corner, you'll see Tdap. It looks like the probably in transmission, it got shifted a little bit, but Tdap arrow should be under 2005. And that's the gray box and the gray line. And so since 2005, that's when Tdap vaccine was approved and recommended by the CDC and ACIP. And between the years 2005 and 2012, several states in the US then made it mandatory as a school requirement. So you can see that the estimated vaccine coverage increases, up to about 2012. It starts to plateau out, and at the last measurement, it was at 90%. Then the other lines, the orange line and the blue line, are for HPV vaccination. And the orange box on the left bottom corner should be under 2006, and that's when HPV vaccine was approved and recommended for girls. And so you can see there was a steady incline or increase of coverage with HPV vaccination for girls. The solid line is in the US rates, and the dotted line is the California rates. And just before the pandemic, it was between 61 and 69% of coverage. Then the blue box or the blue lines should be under 2011 because that's when HPV vaccine was approved for boys. And again, the rates of that coverage have increased steadily over time, and it's basically almost meeting the same rates as the girls. In the US, the solid line, it's up to 56%, and in California, it's also 56%. Okay, next slide. So this is a map produced by the California HPV Vaccination Roundtable from the May 2020 report. And basically it's showing that there are some geographic differences in HPV vaccination initiation rates among the counties of California. The rates range from 34 to 73%, and their higher rates tend to be in the urban areas, and the lower rates were observed in the rural areas of the state. Okay. Next slide. Okay, so the next couple of slides are going to show how the pandemic affected immunization uptake or rates. And as we all experienced in the past couple of years, the pandemic has really affected our usual healthcare processes and routines. So in 2020, there was a period of time, when there was a shelter in place, and in-office care really switched to kind of virtual care. And there were less wellness visits, especially for preteens. I think there was more focus on getting infants in the office for well checks and their vaccinations. And the in-office visits and the wellness checks were temporarily stopped and delayed. So there was less opportunity to kind of catch patients in the office and provide immunizations. So this delay in immunizations is going to be shown in the next couple of graphs. This graph is actually showing Tdap, and Tdap is for the previous graphs you have seen that there was good coverage of Tdaps, and that's because it's required for school. So we kind of use Tdap as sort of like almost like a gold standard of how vaccination rates can be. So on the y-axis is Tdap doses per week. On the x-axis is the months of the year. And what this graph is trying to show in the gray shaded areas, that's 2019, pre-pandemic. And you can see that, doses of Tdap are provided throughout the year, but especially spike up in August when, that's just before school. So everybody wants to get their Tdap before school starts. And then in 2020 is the red dotted line. And you can see that where the arrow is in April, that's really the bottom, like where Tdap doses were not really being given. And then, and that was when the shelter in place order was, health officer order was. And then slowly things opened up a little bit, and the Tdap numbers of doses over 2020 did improve. On the far right side, towards the end of 2020, they even were, maybe you could say they were a little higher than pre-pandemic. And then the blue line is 2021, which is showing the same sort of pattern pre-pandemic in terms of giving out Tdap doses. And even maybe you could even say it's a little bit more than pre-pandemic. And although it doesn't seem like it would be covering the deficits from 2020, but hopefully there'll be some catch up. Okay, so next slide. So this slide is actually similar to the slide we just went over, but instead of Tdap, it's showing HPV vaccination. So again, the y-axis is the HPV doses per week, and the x-axis are the months of the year, and then each line is the different years. So the shaded gray area is 2019, that's pre-pandemic. So the HPV vaccine doses, again, given pretty regularly throughout the year with a spike in August, when kids come in for their wellness checks before school starts, and then maybe peters out a little bit more during the remainder of the year. And then you can see in the red dotted line, which is 2020, which is when the pandemic started, April, again, is when there's a big drop in immunizations being provided, Tdap and then also HPV. There is a little bit of a recovery over the remainder of 2020. And then 2021, last year, again, the graph is showing similar pattern of pre-pandemic with sort of a spike in August, but clearly not as many doses as was given out in 2019. So it appears that there's a larger deficit and not as much recovery from this deficit for HPV vaccination. Okay, next slide. Okay, so all of this background information really shows that there's going to be a lot of hard work ahead of us. And what we really want is, with your participation in this learning collaborative, that you will learn evidence-based approaches to increase HPV vaccination uptake and help reach our collective goal of 80% completion of HPV vaccine series by 2026. Next slide. That's it. Thank you.
Great. Thank you so much, Dr. Chen, for that thoughtful lecture on the data. We want to open up this to a Q&A now from our participants. This will be led by our own Dr. Julie Ding. So again, she's our co-lead for the Engaging Health Systems and Provider Work Group, as well as the Executive Director of the UC Davis Comprehensive Cancer Center's Office of Community Outreach and Engagement, as well as an Assistant Professor for the UC Davis School of Public Health. So I'll hand this over to Julie.
Oh, thank you so much, Dr. Chen and Dr. Park, for the introduction. So we do have one question in the chat, so feel free to raise your hand if you would like to ask the questions, or you can also put it in the chat. So the first question comes from Bernadette. Dr. Chen, and the question is, was there anything particular that contributed to a dip in vaccine uptake in California for girls in 2018 and for boys in 2019? Dr. Chen, you're muted.
Sorry, I think you're referring to the slide that showed, I think you said 2018, did you say? So I think it's two slides back, yeah. Or one more slide back. Oh, yes. This data is CARES data, and so there's not, it can be, there's some caveats in terms of what is available. So I wouldn't say that there's any particular reason for that. I wouldn't say that's necessarily significant dip, is I guess how I put it.
Any other questions for Dr. Chen? So this is any thoughts on how to increase HPV vaccination in 2022?
Is that directed to me or it says to?
Yes, if you had any thoughts on how we can increase vaccinations in 2022?
Oh, okay. I mean, it certainly seems like there were, excuse me, a lot of success prior to the pandemic. So I think if there's some learning opportunities there, I think taking, taking any sort of not having those missed opportunities so that when kids are coming in for even urgent visits, non-febrile visits, that would be a great time to promote HPV vaccine and providing it. I think those kind of strategies I think really can be helpful. Having things like as part of a workflow in clinics where all patients coming in, whether they're coming in for well checks or for a sore finger, that somebody can maybe review their immunization records prior to the visit and then actually be prepared to catch up on any of their shots that are needed, HPV included.
The next question is, how has vaccine hesitancy for COVID affected hesitancy for HPV vaccination?
I don't know if there's a direct correlation. I think maybe those who have hesitancy to vaccines in general may have also vaccine hesitancy towards the current COVID vaccine. But mainly, I think the concern for COVID affecting vaccination is mostly because of just, I think, access to care.
Another question is, are there any qualitative or quantitative data in audiences that believe that HPV increases promiscuity in teens?
I'm not familiar with that data. I'm sorry. I would have to go back and I would have to come back to you about that information. But I'm not familiar with that data. There could be. There may be others that are a little more expert on that can address that question.
So there have been lots of studies regarding increased promiscuity in teens. So I could drop some articles in there about how that's proven not to be true and some statistics on that. So I'll drop it in the box when I have a chance. And then the next question is, what type of health education can be provided to those parents that are reluctant to get their child vaccinated for HPV?
I think there's a lot of information out there, a lot of patient and parent information, education information out there. I think that this work group has provided actually, and the CDPH also has a toolkit that they're going to be promoting. I think it's every spring. I think Jane Gray actually knows more about that than I do, but that's there's lots of available material that's, I know CDPH has some, and I think that this group also does as well. Is that correct?
Definitely. Yeah, there's a lot of materials available and for various languages and for various groups. So we can definitely share those materials at some point. And then, I'll drop some in the box, and then please do visit our website, and we can also include a list of resources and materials on the California HPV Vaccine Roundtable website as well. So we are coming up on time right now. If there's any additional questions, feel free to just drop in the chat, and then we can follow Dr. Chen on those. And then I will follow up with these questions pertaining to any studies on sexual debut, and then also any health education materials as well. But thank you so much, Dr. Chen, for spending some of your time with us today.
Thank you for having me.
All right. So in the last 20 minutes, we really wanted this to be a discussion. We appreciate the active input in the Q&A, but this was built as a collaborative, meaning it was built with three specific goals in mind. The first is to establish a platform through this learning collaborative that will build and exchange knowledge to increase HPV vaccination rates. So we're happy to share these resources and then also hear about your experiences. We're going to be providing these opportunities about the latest HPV vaccination research. And then thirdly, this was a big ask from our previous survey of health systems, was to provide networking and sharing opportunities among our collaborative members, you, as well as our vaccination experts, who are some of the stakeholders on this group. So with that in mind, we want to open up this as a discussion forum. We're going to be going over some of the comments that were made initially in your intros about what you want to get out of this. And then we'll have a poll as to what are the things that you want to learn about and try to prioritize those. So I think Julie will help launch this poll so we can give thought to what are the things that we want to learn about this coming year related to HPV vaccination.
So definitely, so I'm going to share the poll. Then I also, at the beginning of the session today, everyone dropped in the chat what they want to get out of the collaborative. So I'm going to share my screen real quick so you can see what the top responses were, and then I'll launch the poll at the same time. Just give me 1 second. Okay, so here are what folks in the call were interested in getting out of this collaborative, including learning best and effective strategies for messaging in different communities, interacting with experts on increasing HPV vax rates in California, improving ways of case navigation opportunities, just learning more about HPV in general, tips and strategies for providers and staff to increase vaccination rates among patients, looking at strategies to improve HPV vaccination compliance, including that in the community, expanding their own knowledge about HPV and how to help providers improve their rates, reducing barriers to immunization, and then working together to share best practices and innovative approaches. If there are any additional goals or things that you want to get out of the collaborative, please let me know, and then I can add it to this ongoing list. So I'm going to launch a poll now, and this poll really is looking at future topics for our collaborative and other things that folks are interested in learning more about. So I'm going to launch this, and then feel free to answer this poll question. I'll just give it another second to get 80% participation. Okay. I'm going to end the poll and then share the results here. So in addition to the questions that were in the chat box about more information on health education materials, which we can definitely provide and circulate among the group, and also more data on studies about, I guess, the factors that influence uptake. These, let's see, looking at the top choice, and make this a little bit bigger. So 65, so this one's the top choices. HPV vaccination conversations with parents and families, followed by best practices in the clinic setting. And then we have social media and HPV, and just HPV vaccination data in general, and then school-based health systems, and then work on the rural communities, and then drive-through HPV vaccinations. So is there anything that we're missing in this topic list that you would like to learn more about, or anything that we haven't covered? And does anyone else have any comments and thoughts that they would like to contribute to the collaborative, at least for our future session and in general at all? I think one of the big ones is definitely the sharing of resources and materials. Okay, so I'm going to stop sharing now. And then Shante, you can pull back up the presentation. Okay, so we did the poll. So I think the top one was having conversations with family and parents about HPV vaccination.
So, this is the time where we want to hear from everyone else we've gathered those topics, but we do have a little bit of time. If anyone wants to come off mute and share any best practices, share resources related to some of the topics that were entered into the chat or that Julie went over. The format of this collaborative is that we'll have about 10 to 15 minutes at the beginning just to kind of present a topic or, give some information on updates in HPV vaccination. But it really is to ensure that you all can learn from each other and that everyone can be engaged. And this first session obviously is for us to really get a pulse on what everyone is interested in. But, as Susan said, with previous surveys and things that we've done, it seems like a lot of people are kind of zoomed out on presentations. So that's why we chose a 45-minute slot. But really wanted to fill most of it with some discussion amongst us. So, and moving forward, we will have those topics that you all have provided. But again, for this first session, we encourage anyone who wants to share any resources or any responses to some of those discussions, some of the questions that were brought up earlier, please let us know. This is your time.
Or you could also put in the chat, because I know one of the challenges is this is a relatively large forum, and we could consider a breakout session so that we all have time to interact. But certainly I think a lot of us are probably wearing multiple hats, doing both HPV vaccination work as well as caring for patients and COVID work. So for me, I know personally it's been challenging. But we have more and more patients coming back. I'm a clinician in gynecology oncology. We have more and more patients coming back for their preventative care, for their screening. So it's really been an opportunity to talk about the vaccine at every single encounter for me.
Hi, my name is Michelle Shin, and I'm a postdoc at USC. And I'm working with Dr. Jennifer Sway, who's conducting a study related to HPV vaccine implementation in safety net settings. And we've actually been conducting a mixed method study throughout the pandemic. And we will have some data coming up about how HPV vaccine hesitancy relates or doesn't relate to COVID vaccine hesitancy and the conversations that we've been hearing from the parents in the LA County area. So I'd be happy to share that. We would be happy as a lab when we have our findings finalized. But I also wanted to put out a call out there for some of the providers and nurses and even MAs who are working on the ground, that we're currently conducting some interviews, a multi-level interview that has different stakeholders. But if there's any clinicians who are interested in sharing their experiences and perspectives on their experiences with HPV vaccine and having those conversations. We would love to talk to you, especially in the LA County area. And I can share my email address on there, and you can get in contact with me. Thank you.
And then just to get a pulse of the room right now, can everyone use the hands up function or the thumbs up if you are in need of HPV vaccination materials for your community?
I don't know where to find the hands up icon. I've been looking for it, but I can't.
It is under reaction. So thumbs up if you are in need of the materials, and if you can put in the chat box what language you need those materials in. Some folks out there that
It's on the bottom bar.
it's in the, yeah, it has like a reaction with a little smiley face.
I don't see it.
Okay, so there are a lot of folks in Spanish.
You know where it says share screen, and then on the right hand side, it says reaction on the bottom bar.
So there's some folks who are in need of health education materials. And then if folks can also share with me if they need like provider scripts. You can raise your hand and say that you need provider scripts for talking to patients and families.
I do see a hand here, Julie, Lucy, if you want to come off of mute.
Sorry, I put it in the wrong place, but that's okay. Thank
Okay.
you.
And Irene, did you want to share something? You did figure out the hand icon.
Eventually, it took me about 10 minutes. Yes, I think, I don't know whether we're going to resume the announcement approach trainings, but I think that they are valuable in addressing the communications with parents. And on a personal level, when I was still in practice, I'm retired now, I found that the announcement approach, even though I didn't know what it was called at that time, was very effective. And also I found that when I talked about oropharyngeal cancers, that most parents had no idea that that was an HPV related cancer. And it avoided a lot of the stigma that parents bring to the concern about cervical cancer and where it comes from. And I found that my personal immunization rates and that of my department for which I was responsible went up significantly when we started to talk about oropharyngeal cancers. And the other personal thing which I found really helpful was to remember to train the nursing staff in how to communicate with families about HPV, because I discovered after some investigation that the nursing staff, the kids would come in to get their TDAP with a letter in their hand from the school saying, my kid can't start 7th grade or 6th grade without a TDAP, and I need that now. And the nurse would say, okay, that your child needs the TDAP and also needs the meningitis vaccine, and do you want the HPV vaccine? And so they presented it as something that they might not want, and that was optional and not as recommended as the other two. And if you teach those scripts to the nursing staff, that you may not know how they're presenting it to the family. And it may be totally different from how the medical staff is presenting it to the family, that made a big difference too. So.
Thank you. Yeah,
Irene,
thank you for bringing that up.
for those who might not know the announcement approach, can you briefly say what that is?
Yes, there's a training that was created by Dr. Noel Brewer at the University of North Carolina. But there are similar approaches that we also did for general immunizations at Kaiser Permanente, where you tell the parent that the child is due for the immunization, as opposed to asking them if they want the immunization, and that you present it in a very matter-of-fact way. And you don't present the controversies to them. And if they bring up concerns, then it gives you specific scripts on how to address those concerns in ways that have been proven in double-blind studies to be effective communication techniques.
Thank you. And just to kind of respond to Irene's question, this work group of the roundtable, we were offering those trainings, but we just had some gaps because of COVID. But we do plan to resume those soon. So yeah, we'll keep this collaborative updated on when those will be available. But Dr. Irene Landau is a member of our work group and is an expert on this and conducts these trainings for us. So thank you so much for bringing that up, Irene.
You're welcome.
Also, just to provide some more resources to everyone. I want to let me resume because we're coming to the end of the call here. Let's see here. I'm going to go back and share my screen and share where you can find all of the resources that we're talking about. But first, I wanted to mention that we do have future collaborative dates. So we plan to do this on a quarterly basis. The next one is April 20th. And when you register, you might have seen that this is a recurring meeting date here. Now, the California HPV Vaccination Roundtable website, there is a little typo here on the slide, but if Susan or Julie can put that in the chat, it's www.cahpvroundtable.org. You'll be able to access past recordings as well as other recorded learning opportunities. We do have a best practices in HPV vaccination webinar that's on that site. We also have one that was recorded by our parent work group that I think will address some of the questions or provide some information for those questions related to talking to parents. And then we are also working with the Comp Cancer program to develop an online platform for sharing and networking. So on this website, you'll also be able to share and network with each other rather than just attending these quarterly meetings, but we'll have more information as that is completed, which probably won't be completed until the end of June of this year. We do have a couple of minutes left, but I'm going to have Julie drop the evaluation in the chat right now before you log off and leave. Please, please, please help us evaluate this this session. We do want more ideas from you on how to make it the best use of your time. And with that, Julie, Susan, I don't know if you have any final words or any other last comments.
I think we got, the poll was very helpful, so we appreciate what topics you're interested in. If there are other topics that weren't there, please add it to the chat, and we'll design our future sessions to reflect what those needs are. And obviously, if there's another idea that comes up, or if you yourself are interested in presenting, we'd love to have you as part of this collaborative to present.
Just thank you everyone for spending the lunch hour with us, or the lunch 45 minutes with us. And definitely we're open. I mean, this collaborative is for everyone, and it's our community of trying to increase HPV vaccination rates. So we definitely want to share ideas and make sure that we have speakers who are going to be talking about the topics that were resonating most with us, with everyone on the call. So we will follow up with some individuals about some of the questions in the chat as well. But thank you so much for joining us today.
Thank you, everyone.
Bye.
Bye.